World leaders and international health experts kicked off a three-day special session at the United Nations today to discuss strategies to fight the global AIDS epidemic. This meeting marks the first time in history that the General Assembly has convened to discuss issues related to a single health problem. In his opening speech, Secretary General Kofi Annan urged all nations to devote more resources to fighting the disease.
Spending on the battle against AIDS in the developing world needs to rise to roughly 5 times its present level.
He also told government officials to fight against prejudice towards people living with HIV and to treat AIDS patients with compassion.
When we urge others to change their behavior so as to protect themselves against infection, we must be ready to change our own behavior in the public arena. We cannot deal with AIDS by making moral judgments or refusing to face unpleasant facts, and still less by stigmatizing those who are infected and making out that it is all their fault.
Secretary of State Colin Powell said in his speech that the United States is firmly committed to donating its share to the Global AIDS Fund, established in April.
Last month, President Bush announced a pledge of $200 million to jumpstart the Global Fund, goal new public-private partnership to combat HIV, AIDS, tuberculosis, and malaria. We hope this seed money will help generate billions more from donors all over the world. And more will come from the United States as we learn where our support can be most effective.
But many African leaders, including Nigerian President Olusegun Obasanjo, stressed the urgent need for international action in promoting public health in developing nations.
The future of our continent is bleak, to say the least, and the prospect of extinction of the entire population of the continent looks larger and larger.
While much of the agenda has been negotiated in advance, sharp disagreements remain over the division of funds between prevention and treatment campaigns. By Wednesday, the delegates are set to vote on a draft declaration of commitment that outlines a course of action, but they still have the challenge of coming up with language that suits diverse cultural sensitivities. Despite the lingering differences, almost every delegation today echoed one common theme. With tens of millions already suffering from the disease, the time has come for a concerted global effort to find a solution. From UN headquarters in New York, I'm Michael Ye for Newsday.com.